When do I see a urologist? That's what somebody asked me. I said, if you have a urinary complaint, please see a urologist. But let's wake up to the phenomena as to when do you see a urologist. So urologist is a doctor specialized to look at medical and surgical diseases of genitourinary system. What does it mean? It means that there are organs in urology which are inside the body, and there are some organs which are outside the body. That's what a urologist would deal with. He deals with adrenal glands, which are also called as suprarenal glands, which are sitting over the kidneys, and both the kidneys at the back. He deals with the ureters or narrow pipe, which are 25 to 30 centimeters, and which are very narrow as your mobile charging wire, through which urine drains and trickles every minute, made from the kidneys as a solution, which is all about the external waste product that has to be removed from the body. There's a receptacle called the urinary bladder, which is like a bag, which has got a mind of its own, and it's in a very balanced state of relaxation and contraction, and gives you that control, that flow, which is so computerized that you hardly know what happens during the disease processes. Men have got an organ at the level of the bladder neck or the exit of the bladder, which surrounds the bladder neck or the beginning of the urethra, called as a prostate. And then you have got the urethra, which could be 3.5 to 4 centimeters in women, which could be 15 to 20 centimeters in men. You have got the external genitalia, which includes the shaft of the penis for men, and you have got the two testes, which are lying in the scrotum, brought about by that natural morphology of them coming down in the last trimester into the scrotum to keep the temperatures on the lower side, for them to be functional on two aspects, one on the male function, other on the reproductive function. So let's go and understand that when do you see a urologist? So a urologist would be seen only when you have a complaint in the urine, or you have got other reasons to wake up. So friends, a urologist is an individual who deals with congenital complaints, looks with adolescent complaints, looks with male complaints, looks with women's complaints, looks with geriatric complaints, and looks with epidemiological issues. What are they? So congenital issues are they where a child could be born with a pelviureteric junction obstruction. The junction between the kidney and the ureter could be narrow, a little more narrow, and therefore the urine does not come out so freely from the kidney into the ureter, and therefore the kidney gradually balloons up. There is hydronephrosis, a swelling in the kidney. At that swelling in the kidney possibly is as a result of an obstruction. We pick it up on ultrasounds and probably treat them. So that's a congenital issue in many children, even picked up anti-birth, but many a times it is picked up in their younger age group, and many a times never picked up till their adolescents, adults, or even geriatric age group. So pelviureteric junction obstruction or obstruction to the kidney causing a hydronephrosis needs to be corrected in time. This could be corrected as early as 3 months to 6 months in those children who are needy, and sometimes it is picked up late and it is picked up and corrected at that point in time. We also look at congenital issues where there could be vesico-ureteric reflux, a reflux of urine from the urinary bladder back into the kidneys. Normally it's made such that everything is antegrade and urine comes from the kidneys, goes down to the bladder, stored there, and comes out. It could be just the reverse way. That means the urine could actually go back into the ureters, into the kidneys, and probably bring about trouble in terms of unsterile reflux, injuries to the kidney, silent, recurrent urinary infections, and pyelonephritis. So children may suffer from it. If a child suffers from recurrent urinary tract infection, we need to rule out all these issues of what is happening. Women child could be suffering from this. A male child could be suffering from it. So both girl child and a male child needs to be looked at if they're suffering from recurrent UTI. Recurrent UTI always has a cause and need to pick up causes on them. They could be born with deformities of the external genitalia, which could be anything from a bladder being missing or bladder being open, called as extrophy bladder. The urine is coming directly from the tummy. They could be born with hypospadias and epispadias, where a male child could have a urine not passing from the tip, but from the lower part of the shaft, or it could be passing from as an epispadia from the upper part of the shaft. These patients could also be incontinent. There could be born with spinal issues, which could have effect on the urinary bladder, and the system therefore flows retrograde, and these are neurogenic bladders. So there are congenital issues in the spine, congenital issues in the sphincter or control mechanism, congenital issues in the kidneys, and congenital issues in the ureters, which could be mega ureters or vesico-ureteric reflux, where you pick up children much early because of investigation or because of complaints. Complaints could be burning sensation, passing urine with a lot of difficulty. As a small child strains and passes urine and the stream is very thin and the mother complains about it. And this child could actually be having a phenomena of posterior urethral valves, valves which are blocking the urinary outlet at the level of the prostatic urethra. These are all male children. So we're looking at male and female children born with congenital issues. So a child born with deformities, child born with trouble, child born with issues of the kidney, ureter, and bladder would see a urologist in time and probably get it corrected. Let's look at adolescence. Adolescence is that age group where there are milestones changing the child, both in mind and body, a male or a female, undergoing various changes, both on a psychological aspect as well as the physical aspect. A lot of things are happening on the hormone levels, and there could be changes happening. The vesico-aortic reflux may continue to stay. They could develop changes in the organs where the organs may not be growing. There could be a possibility of emergencies. One of them could be torsion testis. The testis may undergo a twist. And therefore, if somebody is having an intermittent pain in the testis on one side, he doesn't have a urinary infection and adolescence. And it's important for us to pick up these phenomena. So all those who have got male children and have got testicular pain intermittently, low grade, or a sudden onset pain in testis where a testis completely turns around and loses its blood supply is an important entity to be known. So adolescence is all about urinary control, is all about looking at a child 6 to 15 years should not be continuing to do bedwetting. That means it's time for us to do a toilet training for the first 3 to 5 years, very, very vehemently, very emphatically, treat the child about the social and convenient places to void and pass urine. But as time goes by, from 6 to 15 years, if a child is having incontinence of urine, if the child is having bedwetting every night or bedwetting even once in a month, once in a week, we got to wake up to it and see our doctors. So we as urologists are involved in looking at adolescent children, both male and female, on organ changes happening around, on kidneys and urinary changes happening, picked up by investigations or picked up by an evaluation for reasons that they have come to see a doctor. I was talking about adult organs and we're looking at all those which a urologist could see. So when do you see a urologist? When you have a urinary complaint. And what are the complaints you have? You could have two major set of complaints. What could be those which are gradual and progressive and you continue to live with it? And the other kind of complaints are sudden onset. For example, sudden onset bleeding in urine is never normal. So if you are bleeding in urine, you will not wait and wait for another date for it to clear. You will go and present the evidence to a urologist for him to pick it up. So bleeding in urine can happen because of severe urinary tract infections, because of stones in the bladder or kidney stones coming down, or because there could be various dyscrasias, or because you could be on antiplatelet drugs, because you undergone angioplasty or you could have undergone a bypass. But it could also happen because you have got cancers in those organs. So which organs can bleed because of cancers? The kidney cancers, the ureteric cancers, the bladder cancers, and the prostatic cancers, or the urethral cancers. The entire lineage can have bleeding because the cancer could be presenting early. Patients on antiplatelet drugs of ecosprin, clopidogrel being taken post-angioplasty to keep their stents or post-bypass to keep their anastomosis spatulus may sometimes bleed because these are blood thinners. So if you have bleeding in urine, you need to see a urologist. Missing it out is always late because many of these things of cancers and stones are picked up sadly late, but they're still picked up only when you have a symptoms unless you are undergoing a health checkup. Number one. If you have sudden onset urinary complaints of not able to control urine, that means you have a sudden onset urgency, urge incontinence, sudden onset leakage of urine, you must see a urologist. He needs to assess your bladder wellness, assess your flow of urine and picks up the right things at the right time. There are those issues which could be infection-related issues, sudden onset burning sensation, passing urine. Sadly, women suffer with more urinary tract infection compared to men only because of the genital organs and the urinary organs are made such. In a woman, the urinary passage, which is the urethra, is just abutted by the vagina and the rectum, which are full of bacteria. And therefore, female introitus is possibly soiled with bacteria, and the bacteria could easily walk into the urethra and cause a urinary infection, even in very young women, and obviously post-menopausal and elderly women. And therefore, recurrent urinary tract infection or urinary infection could present with an acute onset scenario. Burning sensation, pain, discomfort, not able to control urine, fever, all those things starting from the urinary passage or the tip of the urinary passage is something you need to see a urologist more early than late. That time, just taking medicines may not be enough. You may also have to be evaluated. So evaluation is more of a symptomatic and a care that probably stabilizes you. We continue to evaluate and get you treated. At the same time, prevent for future. Prevention is better than cure. And we need to look at that kind of an aspect today. So there could be sudden onset phenomena where you see a urologist. There could be chronic gradual problems. And the commonest problem which we always talk about is middle-aged and elderly men who have got a poor flow of urine. So if there's a poor flow of urine, the urinary flow is very thin. It's a stream is not strong. You pass urine with difficulty. You strain to pass urine, or you cannot pass urine with that amount of speed which you had in the past. There's something going wrong. There could either be an obstruction or there could be a bladder which could be weak. And it's very important for us to wake up to a phenomenon that if my flow of urine is not good, if it is not to what it was before, I must see a urologist. He will do a test called uroflowmetry. He will examine, evaluate, talk, and probably identify those things, and then do the indirect tests of ultrasounds and look at residual volumes. But finally, a poor flow will be measured. Like you measure the heart's beat by ECG, the uroflow is measured and looked at by the pattern that you pass around. So uroflowmetry is a great stuff to give an idea about the translation of your complaints on obstruction to the flow of urine. Very, very important. Elderly men suffer from prostate issues where not the prostatic enlargement alone, but the occlusion of the urinary passage where the urine is not coming out well, needs to be picked up in time. The earlier you pick up, the better the treatment. Earlier you can deviate the natural history of prostatism. The later you do that, the prostatism story has already moved forward and you have all the way gone till the edge of the precipice and you sometimes can slip. You possibly could have an obstruction which could be relating to another acute complication called as retention of urine. The urine suddenly got blocked. Anybody in the world whose urine got blocked suddenly would have discomfort, would have pain, would have got a lot of sensations and would demand relief. And such patients require a urinary pipe or a catheter. A catheter is placed temporarily in the urinary passage because they got blocked. We don't remove them immediately. We leave the catheter as indwelling. We get to understand them, evaluate them, start treating them, and then probably remove the catheter and get them sorted. So there's so much of emergencies which can happen in urinary passages, like blockage, like bleeding, like sensations, difficulty, burning, pain. And sometimes you can have a pain starting from the kidneys, going down to the front and to the down, which means that there's a stone passing down the ureter. So anybody has a flank pain on one side, from the back and going to the front, sadly, possibly you're passing a stone tonight and need to be very careful about it, which means all those who are stone formers in the past could be stone formers for the future. Once a stone former, always a stone former. It's about not what you eat. It's about how the kidney handles the metabolism of so much that is bombarded into the blood, and it has to filter all that efficiently like a computerized system and deliver all that into the urinary environment. That's where the urine should be a completely clear solution rather than too much of sedimentation, aggregation, nucleation, crystallization, and stone formation. Very important for us to wake up to that phenomena that stone formation sadly happens because of supersaturation of urine or because of a huge amount of metabolites like uric acid and calcium oxalate being in the urine, which actually cannot exist in solution. Therefore, they nucleate, aggregate, join, and they form those small stones, which could be the future of the larger stones. So any small stone has got a natural history of either falling down the ureter and causing a ureteric colic, which I just described, or could gradually be very silent and could grow and become big. And that's an important aspect. And it could happen to men, it could happen to women, could happen to children, and it could happen to geriatric age group. Let me tell you that many of you in the audience today may actually have a stone sitting in the kidney, and will you be sitting closely tight enough because you say that is causing no trouble? Friends, a kidney stone will trouble you. It's not a gallstone. A kidney stone will either gradually grow at some point in time when it has a mind of its own and decides to grow. It grows with metabolism, it grows with changes. The growth of the stone could either make it a large stone, too big a stone, and then would require either an open surgery by colleagues or what we do as a puncture to the kidneys and remove the stones. A small stone in the kidney can grow, fall down the ureter and can cause a ureteric colic, a pain which is excruciating on one side, associated with nausea, vomiting, pain, and discomfort. Sadly, those things is not what you want. So if you have a stone in the kidney, you must see a urologist in your city and in your location. The reason is he will identify the ways to treat it, not you. Not that all the stones can be dissolved only because you take medicines. Otherwise, all the shrivelings would be dissolved when ladies pour water on them. It doesn't happen so. It doesn't happen. The stone is itself created by aggregation, nucleation, crystallization, and hardening of something, which are those things which are normally in a powder form. So why did they harden up? To dissolve them may not be easy unless few stones like uric acid, soft stones, which can be dissolved. So friends, stones in the kidney are something where you see a urologist all the time. If you are a past stone former, please do a sonography and see your urologist. I get to see so many of them coming back saying, you called us and you invited us. We picked up a stone earlier than it could have actually fallen down the ureter and could have caused a trouble. And friends, in today's world, in today's era, urologists in this country do something called as retrograde intrarenal surgery. What does it mean? Retrograde, from below through the urinary passage, reach all the way to the kidneys and powder the smaller stones, anything from the region of 4, 5, 7 millimeters to 8, 9, 10, 11 millimeters can be taken care of many a times internally through the urinary passage, all the way through the ureter into the kidney, laser pulverize powder and pull it out. A similar treatment is called as lithotripsy or ESWL, extracorporeal shockwave lithotripsy. When we actually powder the stone from outside, the sound waves go and target the stone through the body, through the kidneys, reach there, powder it, and then the powder is at your mercy of coming down, dissolved, then by the medication. So it's important to look at today, prevention is better than cure. If you have a stone in the kidney, get an ultrasound done, get a CT done, let your urologist understand the Hounsfield units of the stone. Let him decide a treatment for you. He could choose a very small soft stone by a lithotripsy from outside. He could choose a retrograde internal surgery or a flexible ureteroscopy to actually pick up the stone, remove it. You are stone free in 2021. And therefore, you will not have a ureteric colic. You will not have a stone growing and the stone falling down. But remember, you must still form stones. And therefore, there is a huge amount of issues that you need to follow in terms of metabolic workup that we continue doing for many patients who form stones around. So that's some emergency which you can create if you're sitting on stones and thinking that the stones are not formed or they have not given a trouble. Believe me, 95% of patients who come to the emergency department with a ureteric colic tell, we never knew that we have a kidney stone. 5% knew, and they knew and they sat on it. And on the Saturday and Sunday night, when we probably want to relax, is a time we get those kind of emergency calls where there is a flank pain, there's a burning, there's a fever, and there's a bleeding in urine, and a stone is falling down, which was documented on ultrasound year after year. So friends, stone formation sadly is a rule that happens because of a situation in a human body. Not everybody forms stones. And let me finally clarify that stone formation does not happen because you eat something less or something more. Obviously, for the stone formers, there is a way we look at diet. We look at proteins, we look at salts, we look at everything from tea, coffee, cola, chocolates, green vegetables, milk products, and animal proteins to be brought down. But we don't ask them to stop anything. In this city and country where we live and work in, people think that eating tomatoes, eating guavas, eating ladyfinger will actually form stones. The seed forms stones. Seeds don't form stones. Please, for God's sake, let's wake up today and every day that the seeds we take are not digestible. They don't go into the urinary system. So no seeds form stones from tomatoes, from brinjals, from ladies' fingers, and from guavas. Please, you can eat them as much as you want. It's all that you need to have good amount of refrigerant fruits and continue eating them. So you need to look at moderation of diet in stone formation, and that's what a urologist will tell you. He will tell you, improve your water intake across the day and night, divide your water intake so that you have a urine which is dilute or undersaturated of the solutes. He will ask you to take something called a citrate, which is more in lemon and orange, which allows the calcium and oxalate not to join together. So it works more as inhibitor of stone formation. As a citrate, we many a times give as a medical formation to patients for 3 to 6 months and get the internal environment of the urine happening around. So I was talking to you regarding prevention, and prevention is better than cure. And that's what your urologist will always tell you. Let's go and talk about male and female phenomena for which you should need to see a urologist. So yes, men see for men's health, which I do talk from this channel on various sexual issues, which actually is related to the male organ, changing issues on the erection, changing issue on the ejaculation, changing issue on the size. They see because of testicular problems and epidermal problems. They see us because of male factor infertility. They see us because there are varicocele to be treated. We don't treat subclinical varicocele all the time unless they are incriminated in fertility issues, unless they are having discomfort and pain, unless they are too large and would bring about a decay or a atrophy of the testis, which is such an important aspect. So friends, male phenomena are treated by urologists, and you need to see as urologists, andrologists, colleagues see this and probably help you out. But there are also female phenomena. There are phenomena where there's incontinence of urine. You need to see a urologist. You have got a stress incontinence. When you cough, you jump, you run, and you even laugh and you leak urine as a female because you had something which developed after the first or the second childbirth, because it developed after menopause, and you learn to live with diapers or don't drink water and live in shame, embarrassment, and isolation. It is time to break this silence and probably get treated, because incontinence is treatable. That's the good news I can tell you. So why should you live on diapers? Why should you not drink good amount of water? Why should your urine be smelling? Because you have decreased water intake, your urine becomes more acid and more concentrated. Friends, a urologist is a friend you should make in your country, in your city, because it's important for you to know that there are so many things which exist. As age changes around, we look at a lot of changes happening internally. And one of them, sadly, is cancer of various genitourinary organs. And that's where I need to look into. The kidney cancers, the bladder cancers, and prostate cancers happen to be more common in smokers and tobacco users. Remember that. So if you have been a smoker, you may lose your sexual function much faster. You are prone to cancers. Obviously, you've got the lung diseases and host of other diseases happening around. But as a urologist, I must tell you that the kidney cancers are more common because of the toxicity of the nitrosamines, which brings about changes which are irreversible. And that kind of a totipotential change which happens around in the urinary bladder, in the kidneys, and the recent studies from Scandinavian countries has talked about even the prostatic cancer changes are much more commoner. Their chances of progression are much more severe than the non-smokers around. So if you're a smoker today, give up smoking. Quitting smoking is answer, not decreasing the number of smoking, because a drop of poison is equal to a kilogram of poison. So why do you want to take a kilogram? Take a drop and that's good enough. So in other words, we got to be inspired that we don't want anything which could bring about a trouble and tormentor for the future. So cancers of the kidney, cancers of the prostate, cancers of the urinary bladder, and cancers of the ureter. Today in this era, we are doing by a minimally invasive treatment, first by making you aware, picking it up in time, and identifying it completely. Once we do that, we stage it, grade it, and in today's era only are we picking up early diseases. And early diseases are all about you came in time, your doctor worked hard, picked it up, and treated and cured you. And that's what you aim for. A robotic surgery is something which we do by a high degree of precision, where I and my colleagues continue to doing a robotic surgery for a cancer prostate, where we remove the entire prostate and bring about anastomosis between the bladder and the urethra, where we remove the urinary bladder for an advanced in the wall bladder cancer, which is existing, coming as a high-grade cancer, as a muscle invasive bladder tumor, something which needs to be removed around. That's being removed robotically compared to the era where you used to cut open and do those very long surgeries. The kidney cancers, which are very small and localized, are even undergoing partial nephrectomy robotically. And otherwise, we do a radical nephrectomy for those large cancers. We clear them up completely. So apart from doing a lot of reconstructive work on the robotic work, which we continue to do, we do a lot of cancer work around. So a urologist is a friend of yours who is a partner across the table to identify, interrogate, and interview you on the problems that you have. But rest assured, today is the era also of identifying ourselves. And therefore, a lot of us actually do something called as health checkup. And that's a great thing. Salute all of you who look at your health proactively. That means you pick up things earlier than a doctor would pick up or you would pick up. So you undergo that set of investigations and health checkup, which sometimes are very focused: diabetic health checkup, men's health checkup, or probably a cardiac health checkup. But the general health checkup for everybody beyond 40s, where you pick up your creatinine levels, where you pick up your serum PSA levels in your 50s and beyond, where you look at your ultrasounds and pick up anything in the kidney, which is very silent and incidental, is such an important issue. We got to pick up all that. And once we have picked up, I don't think we'll sit on it. So the commonest thing which you pick up on a health checkup is a kidney stone. Let's not sit on the kidney stone, please. The kidney stone will either grow or will fall down, and both of them could be peril at the wrong time. Possibly you don't want it to happen. We pick up a lot of tumors which are more picked up by expert sonologists today, where a small tumor which could be there or a large growth could be there. More so, you could be a smoker or a non-smoker. We pick up obstruction like a pelvic junction obstruction. We pick up growth in the bladder. We pick up an enlarged prostate. Then you go and ask your urologist, which I continue speaking about, as to what does a prostate do to your urinary passage. It causes an occlusion or an obstruction, which needs to be looked into and treated. So you need to see a urologist for all reasons around. Geriatric age group, you could have nocturia or getting up multiple times at night. If you continue to live in agony at night, be awake whole night, partly because your sleep is so less in the elderly age group, and because the urine production is more at night, you need to do a behavioral therapy where you cut down your liquid intakes in the evening. You cut down your tea, coffee, cola, alcohol, and milk at night. You take all those things which you take in 24 hours in the first 12 to 14 hours. You see that you have got 2 hours gap between your dinner and sleep, and that time you're not drinking too much of liquids around. So you bring about a behavioral therapy which your doctor will tell you. He will take charge. He will take charge of this mantle and probably vanquish all those problems of nocturia or getting up multiple times a night by assessing you, evaluating you. For children between 6 to 15 years, I think all mothers should bring their child to their doctors. It could be pediatricians, it could be urologists, it could be physicians who would look at enuresis or bedwetting is not a child's mistake. It possibly is the rhythm between the brain and the bladder has gone wrong. It has not yet improved completely. And that is something which we need to sort out. Remember, middle-aged and elderly people also undergo bedwetting. And bedwetting is quite a shameful phenomenon to them socially. And they come probably the next day morning and say, Dr. Pandey, I had a leak in the bed at night for the first time. For the second time, I'm leaking every night in the bed. So we got to wake up to that phenomenon. So isn't there multiple reasons that you need to see your urologist? You need to do your health checkup. Don't postpone urinary health. If you had a stone in the past, you may form stones again. If you had a urinary incontinence which has been treated with medicines, Look at that as continued therapy rather than stopping the medicines completely. If you have prostate issues and your doctor started medicines, you need to follow back. You need to look at a sonography, looking at the attempt to shrinkage of the gland, looking at the flow pattern by a uroflowmetry, looking at an yearly PSA and picking up things around. So the entire attempt today was to wake you up to positivity of seeing a urologist in time rather than scaring you. It is about understanding that we meet our urologists, pick up things in time and possibly get treated and cured much faster and better rather than waiting and postponing health. Because urinary health, once gone, may not come back. Once I become 50, I will never become 40 again. That's such an important aspect to be aware. So friends, urology is a subject which many a times is hidden and many a times has not been spoken of and not probably brought to the society. The attempts that we make in awareness drives from this platform and from platforms across the country and the world is to look at, let's be ambassadors on the subject that you've heard this. If you and your family, your colleagues, and probably people in your company who go through that kind of a discomfort, it's not right to postpone. It's nice to see a urologist. You see them and they would thank you for having come in time. You always ask the question, Doc, have I come late? And the doctor would always say, whenever you came, our story starts from there. So we take over the baton from you and start treating you. We look at cure. The earlier you come in, the better it is. But friends, prevention is better than cure. And to prevent, you got to listen to these kind of awareness issues, pick up things in time earlier than probably you would pick up if you would wait and probably let them become a bigger demon. Urology is all about dial U for urology, and there's so much happening around. There's so much in this subject all over. So from quality of life diseases to life-threatening diseases, our job is to sort it out forever. Thank you so much.